now every other child has PCOD. It has become so scary.
Irrespective of the age.
Irrespective. I mean, a 13, 14-year-old teenager walks into my chamber, and I look at her and I know she has PCOD even without putting the ultrasound probe on her. You go to a diagnostic center or hospital who has a good radiologist. And here I would really like to take this opportunity to tell the audience who are listening to me, please check the credentials of the doctors. And people with 6 months of ultrasound training, with 3 months of ultrasound training are, just putting up a machine and, putting some doctor's name in the front and doing the ultrasounds. So please check the credentials of the doctor, see the kind of degrees, the kind of specialization. Of course, MD in radio diagnosis, then from which college they have done is the most important. We can visualize them very well. We can visualize the neck, we can visualize breast, abdomen, legs, arms, eyes, most of the things we can visualize, and we can usually reach to a good diagnosis wherein the radiologist can then advise whether a CT is more important or an MRI is more important. That even if you are a radiologist, we have to see the patient as a whole. We can't just think that, okay, it's COVID, so well then everything is COVID. At least ask the patient, do you have any heart problem or not? Actually, I as a radiologist, I actually encourage people, please do read up Google. Here the ego is actually very detrimental. I feel as a physician, as a radiologist, as a clinician, as a doctor, my ego should be seen. So I think ultrasound is, of course, the modality of choice in pregnancy, because there in pregnancy there's not much else we can do with a pregnant patient. First scan, which is of most importance, is the early dating scan. I recommend getting a dating scan done at something like about 7 to 8 weeks.
Dr. Pallavi, thank you so much for taking out time for this particular podcast. I really appreciate your time. And just to start this podcast in a formal way, first of all, I request if you can share your journey, 30 years of journey in this particular field, and then we can proceed further.
First of all, thank you very much for having me here. Yeah, my journey in the medical field is quite a long journey. I did my MBBS joined in 1989 and from the renowned university, King George's Medical University, Lucknow. And I've been a good student all my life. And after finishing my MBBS, I was very eager to join an upcoming new branch. And at that time, radiology, which is now, it's still the topmost branches which all the undergraduates want to take for their graduation. But at that time, radiology was rapidly evolving, mostly in all of North India. I'm talking about 1994, 95. Mostly in all of North India, radiology was only supposed to be X-rays. And you'll be surprised to know that nowadays radiology has been taken up by the toppers. At that time, nobody wanted to take up radiology because it was only and only X-rays, and it was a very, sort of a branch which was not many people were interested in it. However, at that time in Lucknow, Sanjay Gandhi PGI had just started, and they had established, alongside with collaboration with Japan, the state-of-art radiology department. They had their best CT at that time. They had MRI at that time, which I think in 1994-95 was maybe only the first MR in whole of North India, if I'm not mistaken, or maybe Chandigarh PGI had an MR. So I was really eager to explore more about it. I was very fortunate to, at that time we had only one general seat in radiology in SGPGI, and I was very fortunate to get into the second batch. So my batch was a second batch from SGPGI. And again, I was fortunate enough to learn with the doyens of radiology, and we learned everything about ultrasounds, about Doppler studies, about CT, about MRI, about intervention radiology. So in my 3 years of doing MD in SGPGI, I really put in a lot of hard work and ended up learning most of the areas, all the areas of radiology, and it was a wonderful learning experience for me. So that is how ultimately my journey started. And today I have almost 30 plus years of experience, and radiology being a very technical branch, it has really evolved rapidly. And being a radiologist, I have to keep in touch with the subject, with the recent advances, with the technology very, very rapidly. I have to really keep reading. Every year, the machines and the technology is changing. So I find it very interesting. Even though I'm a medical person, medical people are generally not good at their technical work, but I really find it interesting, and I like to learn the machines. I'm pretty good with the technical work as well. So that's where I am today.
Great, great. So before we go deep into your core experience, I like to know more about the thought behind your current practice, mind, body, and wellness. When you have started this practice, and what is your motto?
Yeah, so I was primarily a radiologist. I was in the private sector for a long time. Then I joined King George's Medical University as a faculty. And so one fine day, I myself got diagnosed with a lot of lifestyle diseases. I was not fit. I never used to exercise. I used to live on Haldiram Namkeen and all sorts of tea and cold drinks and soft drinks. And I must be about what 43, 44. Maybe this is about 10 years back when I was suddenly diagnosed with all sorts of lifestyle diseases. And then the reality hit me when I started running between my own friends were endocrinologists, they were diabetologists, they were physicians, and everybody kept prescribing me medicines for something or the other. But it made me realize that, and so the feeling of being unwell was actually really bad. You wake up every morning, it's a very unproductive life that I was leading. I was just waking up feeling really low, not feeling happy about whatever I'm doing. I was getting into one of those very irritable phases in my life as uh, because I was not feeling well. Everything used to feel like a big load to me. So that is where slowly I started reading about stuff like intermittent fasting, stuff like strength training, stuff like what kind of cardio is important and what is better, what is keto diet, what is like low carb diet, can we mix and match a balance of all of those. So that is where the curiosity, it was completely and entirely because of my own struggles with health. And the obesity and all those genes of obesity, hypertension, diabetes, they really ran in my family, and I was extremely concerned that at the age of 43, by the time I turn 50, I'll be literally on the bed, and I have two beautiful daughters. I didn't want my daughters to grow up with the stereotype of their mother being one of those perpetually sick characters where she's waking up in the morning and complaining of some pain here, there, and wherever. So I think that was where this whole journey started.
Right, right. And I know for a fact that you are also working as a consultant and giving guidance in terms of nutrition and wellness to your patients. So how do this particular aspect has changed perspective of your patients? So whenever someone comes to you for any sort of like diagnosis for like ultrasound and all, what kind of other advice you used to give basis on whatever you are looking at in their reports?
I think the first thing which happened is that I became more kind and more empathetic towards my patients,
Mhm.
because generally doctors per se are, they really do not realize that a person with fatty liver just doesn't have a fatty liver, but they have all the other problems of this fatigue, listlessness, body ache, and again being unproductive thanks to their wrong nutrition and problems like fatty liver. Again, PCOD, it is such a lifestyle related problem. When I did my MD way back in 1995, one in maybe 1,000 scans I used to do was one female used to have PCOD. I remember we as residents, we used to be called by SRs to come and see that this is a case of PCOD. Look, this is how the ovaries look like. And now every other child has PCOD. It has become so scary. It's
Irrespective of the age group.
irrespective. I mean, you a 13, 14-year-old teenager walks into my chamber, and I look at her and I know she has PCOD even without putting the ultrasound probe on her. So even though when I'm working as a radiologist, and I because I'm working with a corporate, I don't necessarily sort of give them paid advice related to nutrition, but I do try to tell them as much as possible that stay away from packaged food, junk food, lifestyle changes. A lot of people then try to look me up on my social media and my Twitter handle and everything, and they see the kind of advice I'm putting in, and then sometimes they directly connect with me or they just look at the advice I'm giving them. And a lot of people have come back to me and have said that it really has helped them.
Right.
So I think for a doctor, it is very important that we think beyond medicines.
Absolutely, agree. I
That's the
agree.
most important
And
thing.
as we talked about lifestyle related diseases and other things, so apart from the couple of things you have mentioned, what all other type of things you are looking at in your patients? Like, what is the new trend coming in, irrespective of age?
Mostly all the diseases these days, except for the communicable diseases like the viral flus, all of these,
Correct.
or things like rabies or tetanus,
Mhm.
they are mostly all lifestyle diseases. Mostly
Mhm. Because of
infertility.
food habits,
Yeah,
or
food habits, sedentary lifestyle, junk food, processed food, Swiggy, Zomato, the rest of the stuff. Me, in spite of so many times saying that we shouldn't eat clean, there are times when I'm having a very busy, stressful day, and I'm like, okay, just let's see what's there on Zomato. Ping it at 5 minutes, it's on your doorstep. With all these 10 minutes, Zepto, Blinkit, everything is there at your doorstep. You don't have to think about it. So there's no planning involved. There's nothing that you have to get up and make something. It's all lifestyle related. And of course, environmental causes like pollution, and Delhi pollution plays a major role. So it's all lifestyle related. When I was a medical student, most of the cancers which we used to hear in our medical books, it was mentioned it's got an age group of like 50 to 60. They've all come down to 30 to 40. Breast cancer, the direct using of so many deodorants, so much perfumes, of course, constantly wearing a lot of rayon-based fabric, everything is causing a problem.
And I believe all these things are because of lack of awareness.
Of course.
What kind of food items we are using, any
Of
aerosols
course.
and perfumes and
Of
other
course.
things that can lead to
Of
such
course.
serious conditions.
Absolutely. So my own daughter, who's currently, she's settled in Australia, she's a psychologist. During COVID times, she was there in Australia. They were spraying so much of these sanitizers all over the place, on her laptop, on the table, everything. And she was constantly developing an allergy on her hands, on her arms. And she was constantly sneezing, she was just, like every time she used to get tested for COVID, because people used to say it's COVID. And then I was like, what is going on? Like, of course, all her tests were coming out. And then ultimately, after asking her 10 times, then I said, are you using too much sanitizer? She was like, yeah, we are spraying sanitizer like a perfume or like a room spray. And then I was like, oh my God, stop using that sanitizer. Those have those chemical droplets which are getting into our skin. They're constantly being absorbed by our lungs. So I am so much against usage of all these things. In my hospital also, I'm like, just open the door for a while rather than coming inside and spraying all the deodorant, this room's fresheners and stuff. It's the problem is the consumer driven, and the problem is, of course, we know that most of the companies are, giving us those beautiful advertisements and stuff like the room fresheners are showing us those lovely, beautiful smelling homes and bathrooms. Our advertisements of stuff like those sugared energy drinks which all the children have, naming a few like Complan, Bonvita, Horlicks, which even we had as children. All the mothers look at them and they are like, oh, we want our children to grow tall, strong, succeed in all the competitions, do well in swimming and the rest of the things also. And they keep giving all those sugary sweet drinks to their children, not realizing the harm it's doing. Childhood obesity, fatty liver, you'll be surprised to know the youngest I have seen in a fatty liver was a 12-13-year-old boy. And it was grade 2-3 fatty liver where all his parameters were deranged. It's so scary. And fatty liver is now becoming the prime cause of liver failure. Alcoholic liver disease used to be the prime cause of liver failure, and now non-alcoholic liver disease has surpassed the alcoholic liver disease.
Absolutely. And couple of weeks back, I was doing podcast with one hepatologist, and he told me that in India, by numbers, every second or third person has fatty liver. Irrespective of the grades, they have fatty liver, and all these cases are non-alcoholic fatty liver cases.
Absolutely. It's those late night junk food eating, drinking. Now, see, when we were young, it was we never used to party and binge drink. Now, weekend parties, binge drinking, that's become the protocol of everybody's. Like, it's almost like mandatory. If a person like me is invited to a party and I'm like, oh, I sleep at 10 because I have to wake up in the morning and go to the gym, people actually start laughing at me, and they sometimes stop calling me because they are like, oh, she might just suddenly call off the party and go home at 10:30. And to be very frank, there have been incidents where I have also, like, okay, just taken a couple of drinks or slept late. my body completely rejects it now. I feel so miserable next morning that I'm like, next time I am not going to do this.
Correct.
So we can actually train our bodies to reject and to accept things as we have. It's actually a training process. But yes, non-alcoholic fatty liver disease has become the biggest pandemic of today's era.
Noted.
And non-alcoholic fatty liver disease is now linked with heart issues, with kidney issues, with diabetes. You name it and you have it.
Correct.
So it's like that.
Right. And now coming back to your core competency. So during your masters, you must have trained on various diagnostic techniques, including CT, MRI. Apart from all these things, when and why you have decided to pursue ultrasound as your like super specialization and doing your core work in this particular field?
So for years, actually, after passing out from SGPGI, I was one of the very few radiologists who knew a lot about CT and MRI. So for years, I worked with CT MRI. Then I joined as faculty back in my alma mater, KGMU, and I was actually heading the cardiac CT department. So I was actually only working on cardiac CT and of course MRI, whatever else came my way. But after working for years, being the man behind the machine, somehow I felt I was losing the touch with reality, with my patients, with the happiness you get when you meet patients, or whatever was my skills which I developed about fitness and nutrition. I could not impart it to anybody. I used to see those cardiac CT of young 30-year-olds, and I used to see all calcifications and narrowing and stuff like that. But I hardly could talk with the patient because once the report is ready and signed, it's just usually dispatched from the receptionist. And if you actually see yourself, if you would have gone to any of these bigger hospitals, and if I ask you that which doctor did you consult for your CT and MRI, like which radiologist, you would generally not know. You would say, oh, well, I went to Fortis, I got my CT done. But who was the radiologist who saw your CT or MR? You would really not know. So this is where, in between my getting into KGMU and my getting out of MD, I was also working with a couple of diagnostic centers where I was doing ultrasound. And I think I felt those were very happy years of my life because I was really getting the impact of dealing clinically with dealing directly with the patients. So when we relocated to Noida, moved to Noida from Lucknow for the future of my daughter's education, I sort of got back into ultrasounds, and I felt it really gives me happiness because I am quite a people's person. I actually like talking to people, and I like talking to the whole family, and I like a lot of my patients have actually become my friends now. So many of my patients, they just became a part of my friends and acquaintances and family friendships. So ultimately I decided that I will keep my core competency as ultrasound. Currently, I'm in Cloudnine, Sector 51. I'm working as a senior consultant, and I'm having a lot of fun because, of course, there they're not even patients. For us, they are our clients because they're just pregnant women who are coming to us, I have a lot of fun showing them 3D, 4D and spending an hour with them showing that the child is waving and the child is smiling. And that smile and that happiness which I see on the patient's face, that's a different feeling altogether. So that's the reason ultimately after years of doing everything possible in ultrasound, I was like, let's get back to ultrasounds now.
Great. And I like to know more about the importance of ultrasound, right? Not only in case of like pregnancy, but in general healthcare perspective.
Yeah.
Why ultrasound is really important, and if you like to share more details about ultrasound just for the knowledge enhancement of our audience.
Well, ultrasound is become like the stethoscope these days. Like how initially doctors used to be diagnosing things with stethoscope, the very basic things. Ultrasound is now like the stethoscope of every clinician. Ultrasound is so very important, and I actually recommend any person over the ages of 40 just to go ahead with a screening ultrasound once a year or once in every 2 years. And women, of course, above the ages of 55, breast ultrasound, a whole abdomen ultrasound, and an internal transvaginal ultrasound, at least in the beginning yearly, and then maybe once every 2 years. If you go to a diagnostic center or hospital, who has now the importance come, who has a good radiologist. And here I would really like to take this opportunity to tell the audience who are listening to me, please check the credentials of the doctors, because nowadays, unfortunately, medical education has gone for a toss in our country, and people with 6 months of ultrasound training, with 3 months of ultrasound training, even technicians are, just putting up a machine and, putting some doctor's name in the front and doing the ultrasounds. So please check the credentials of the doctor, see the kind of degrees, the kind of specialization. Of course, MD in radiodiagnosis, then from which college they have done is the most important. The other degrees which are good are if you have a diploma in DMRD in radiology and some sort of a fellowship or something to enhance your diploma, or a DNB course in radiology, DNB part 1 and has cleared part 2. That is very important. I have seen people literally going to any diagnostic centers without bothering to find out which is the doctor, who's the man behind the machine after all. I mean, even if we are going in for interior decoration of our house, or we are planning to buy a mobile or a microwave, or even like maybe just one bottle of water, we do check which brand is
Correct.
best. But here we are just going to any
No due
diagnostic centers,
diligence.
any path lab with the no credibility
Mhm.
checking. So I think that is something most important. However, if you go to a center, a hospital or a diagnostic center which has a good quality machine and which has a good radiologist, you can actually pick up anything possible.
Right.
Of course, chest, lungs is something which we don't see by ultrasound. The pleural cavities, those are the cavities surrounding by the lungs. We can visualize them very well.
Right.
We can visualize the neck, we can visualize breast, abdomen, legs, arms, eyes, most of the things we can visualize. And we can usually reach to a good diagnosis, wherein the radiologist can then advise whether a CT is more important or an MRI is more important. Now, again, there the problem occurs, like in a lot of cases, for instance, in gallbladder calculi, ultrasound is the diagnostic investigation of choice.
Correct.
However, I have still seen a lot of clinicians referring a patient for a CT. And on CT, because the calculi in the gallbladder are very soft calculi, they are hardly picked up on a CT.
True.
So there the CT scan person, whoever is seeing the CT, will then again say, let's correlate clinically with ultrasound. Whenever I have been reporting my CTs, I always take the patient back to the ultrasound table and then try to see the gallbladder. Are there calculi, or is there any sludge, or is there any cholesterol crystals, which are all missed on ultrasounds. However, if these stones have slipped into the pancreas, then the pancreas is usually something which is diagnosed better by CT. Again, if there is something like, a disc pathology, or something like a brain pathology, then MRI is the diagnostic investigation of choice. So here also, actually, the clinician should definitely ask the radiologist, what do you think should be the next investigation that we should do? Should it be a CT? Should it be an MRI? Or should we just wait and watch? So many times I just tell them, let's wait and watch. We'll get to know ourselves what's going on with the patient.
Correct.
If it's a liver abscess, for instance, why you really don't need to go ahead with a CT. The clinical scenario of the patient, having fever, pain, and by ultrasound you diagnose a liver abscess, there's really no need to go ahead with a CT.
Correct. And I believe in terms of like patient education is really lacking in our country.
Yeah.
Some of the people, they are aware about what kind of blood tests they need to go, but in terms of anything related to radiology, I don't think so people are aware.
Not
and
at
even
all.
People are not doing Google search properly.
Not at all. Not
right?
at all. I totally agree.
They
People
just
are
go blindly to
really
any
clueless.
clinician and
in fact, that's why you must have seen that these days on my social media. In fact, I'll be trying to, like just now while we're talking, I'll definitely try to make this a reel on gallbladder calculi, because again, it's become a very, very...
and I think you should also make some content in terms of spreading awareness that for what particular organ, as we talked about, for pancreas, maybe CT is the important thing to diagnose any sort of an ailment. For liver, yes. For gallbladder, we have
for gallbladder we have ultrasounds. Yeah.
So that is something patients
Absolutely.
should know basis on what kind of problem they are facing, or if they just like to take a second opinion,
Absolutely.
they should know what kind of not treatment, but diagnostic technique they
At
should go
least,
to.
yes, absolutely. Everybody believes that, well, since MRI came up, suddenly people think that MRI is like the topmost thing of,
Yes.
uh, it'll
Anything which
literally,
is most
everything will,
expensive, people
yes.
generally think
And
they are
it
getting
will
the
literally,
best
the
treatment.
machine will, absolutely tell you this is the diagnosis. And now this will be your lifespan after the It doesn't happen. Just recently, I came across a case where actually the ultrasound clinched the diagnosis. In spite of my only telling it was a case of a young child with she had, in the MRIs, it has been diagnosed as an absent uterus and ovaries. However, when after a year, the patient came back to me, I could see there's some rudimentary horn, something there. And then I had to tell them that, well, on ultrasound, I think definitely we have clinched the diagnosis. But again, everybody wants to go ahead with an MRI.
Correct.
So after doing the whole MR, again, the MR, the radiologist who was reporting the MRs again said that let's clinically correlate with ultrasound.
Absolutely.
So it was a
I
whole
completely
circle
agree.
back.
Correlation is really important. And
Absolutely.
just like to know, in India, is there any mandate wherein physicians from various like specialized field, they need to interact before coming to a conclusion? For example, or it's something really subjective and there is no
It
such
is really
protocols?
that is a little sad that it is pretty
Right.
subjective. Better hospitals, of course, the bigger and the
Because
better
if it's
hospitals.
matter of somebody's life and death,
Absolutely.
there has to be
Well,
very
maybe let me
close
tell you a
coordination
very
with.
short story about my own mother, wherein literally my being a radiologist saved her life. So, well, she had I think in the third wave of COVID, she had a mild attack of COVID. And because she's also a cardiac patient, she was admitted in one of the local hospitals. And I have no idea why they started giving her a lot of fluids. In spite of my telling them, but again, it was like I also didn't think that, there's any problem in giving all those fluids. So she started getting a lot of fluids and she started getting really breathless. And the moment she started getting breathless, the physician said that her COVID has become worse. And of course, we all were panicking because after all, it's COVID. So she was shifted to a bigger corporate hospital, wherein again, everybody was like, he is looking at COVID. However, I was insisting that let's get a CT done. Even if it's COVID, we have to start scoring her. The moment at the middle of the night, the CT scan technician sends me my mom's this thing link on and I look at her CT and I'm like, oh my God, she's in cardiac failure. It's those fluids which they have pumped inside her body that just led to her heart getting failed. Actually, the lungs hardly had any COVID to be seen, but her whole body was filled with fluid. Her heart, her lungs, her abdomen was just filling up with fluids. And so in the middle of the night, me being a radiologist had to actually, really discuss very aggressively with the treating physician and choice that it is not COVID. She's going into heart failure. Shut the fluids, give her Lasix, because otherwise by the morning she'll be dead. And in spite of that, next morning, okay, well, they heard me because I'm a very senior radiologist, and they stopped her fluids and they gave her Lasix. And by morning, the cough had gone, her breathlessness is gone. But yet the radiologist, when he made the report, he still mentioned it as, pleural effusion because of some COVID pathology. So then I had to actually again go back to the radiologist and tell him, you have to think of you have to think of the patient as whole. Exactly. And that is what was taught really to us, thanks to my KGMU teaching experience and SGPGI, that even if you are a radiologist, we have to see the patient as a whole. We can't just think that, okay, it's COVID, so well, then everything is COVID. At least ask the patient, do you have any heart problem or not? So I think a lot of patients must be suffering because of this whole situation.
I also had that sort of experience during COVID times. I know that was a panic situation, but whenever you get any patient, asking right questions is really important. Whenever any hospital or any clinician miss that particular point, getting the initial diagnosis right, they may end up giving the wrong treatment.
Yeah.
So if you know if somebody is diabetic, they have high
Absolutely.
BP, all the line of treatment will automatically
Diabetes
get changed
just shot
because
up horribly after COVID.
Yes.
So many of my known to people who were never diabetic, they suffered so much, and they suffered somebody's hip went, somebody's liver went, something or the other kept happening. Actually, I as a radiologist, I actually encourage people, please do read up Google. Read and ask me questions. When you ask me questions, I'll reply to you. And if I reply to you, here the ego is actually very detrimental. I feel as a physician, as a radiologist, as a clinician, as a doctor, my ego should be zero. most of my own colleagues, I do feel that they get very irritated and they're like, patient just reads up Google and come up. Why not? Why shouldn't I? Even I read up Google so many times. If I have to decide between couple of 3, 4, 5 brands, maybe buying up my mobile phone, I'll read up Google and come. So I always encourage the patient, please, this is the diagnosis, this is what I've written, please read up Google. You, any question you want to ask, I'll give you the correct answer. So, then the patient is also very happy.
Correct.
So rather than all the time telling people that you are coming, you are reading Google and, it's not the right approach, let's encourage technology.
Agree.
I post so much data on Google that if most of the things which I say, if you check my profile on Google, most of the same things will be coming out, because doctors have to also learn to take technology, make technology as their friend, not to make them their foe, that patients just read up everything.
Correct.
In the Western countries, patients are actually very informed, and that situation of doctors playing God, we can't do that anymore.
True.
Like how our previous generation used to
We
say
just
that.
have to make patient aware that what is the current situation and what will be
Yeah,
the line of
we can't
treatment,
play God with the patients.
let them decide. From
Absolutely.
doctors, and the only duty is to give them right direction.
Yes.
We can't force or convince anyone
We cannot.
go on such.
I never do that. I'm like, this is what I have thought. This is my point of view. This is my suggestion. I'm giving you this suggestion. Rest, you can, go for a second opinion, talk to any other person like that.
Right. And Dr. Pallavi, the next topic I like to discuss is related to importance of ultrasound and various sort of scans during the time of pregnancy, like dating scans and NB. What is the importance and what kind of issues you generally encounter nowadays, which maybe increase in number as compared to previous years, and any underlying conditions?
So I think ultrasound is, of course, the modality of choice in pregnancy, because there in pregnancy, there's not much else we can do with a pregnant patient. So definitely the first scan, which is of most important, is the early dating scan. I recommend getting a dating scan done at something right about 7 to 8 weeks. Even though many times the patient does come for an earlier dating scan because the patient is so nervous and the patient is really wanting to know what's going on. But in my point of view, the patient's first dating scan should be 7 to 8 weeks, wherein what we see is the embryo, or what we also call as the fetal pole. And then we document the cardiac activity. So the cardiac activity is initially a little slower, something like about 120 or so, and then slowly over 8 to 9 weeks, it goes up to 170, 180. If the cardiac activity is on the lower side, that has to be very, very strictly monitored. If the fetal embryo at 6, 7 weeks is not well identified, in my clinical experience, I prefer to tell the patient to just wait and watch and come after a couple of weeks, because many times these days, because of underlying PCO, the patient is having delayed conception. Just a couple of days back, I had this patient walk in from a nearby diagnostic center who had labeled the patient a week back as an abortion, because the cardiac activity was not well visualized and the embryo was really tiny. Thank God the patient didn't go ahead with a medical termination abortion or something like that, because after 10 days, the patient walked in and the whole live fetus was there. So we have to be very, very careful. I always tell all my colleagues also that let's play it safe. It's very easy to label something as abortion, but let's play it safe. The patient can wait for a week, 10 days, and we can just correlate with the beta HCG levels, because again, the beta HCG levels should be rising. In case they are plateauing or they are falling, then we can be safe to say, okay, this person is landing up into a pregnancy failure. So in the dating scan, we see this. And if there is no gestational sac visualized inside the uterus, yet the beta HCG levels are correlating to a pregnancy, then we have to look in for an ectopic pregnancy. That is very, very important. So in such a patient, we do a transvaginal scan. That is an internal scan. We look at the uterus and then we look at both the ovaries. Any suspicious area should be documented if the beta HCG levels are elevated. And then it is always better to talk to the clinician. Well, the beta HCG levels are elevated, and I am seeing something suspicious, let's wait and watch, let's observe the patient very, very carefully. Maybe let's scan after a couple of days. And so many times I've caught an early ectopic in that way, because if an ectopic is not caught early, if it's caught early, you can give a medical, again, a medical treatment to the ectopic. But if an ectopic is not caught early and if it ruptures, it's a complete medical emergency, and the patient can actually lead to death as well. So that is what is usually done during a dating scan. Then the next scan, which is important, is the NTNB scan, which is the 11 to 13 week, 6-day scan. And in that, we try to see the early radiological signs of the important anomalies which are just not compatible with life.
Any like chromosomal syndromes?
All the
anomalies?
chromosomal anomalies, which are not compatible with life, like Down syndrome, Edwards syndrome. So we have a mandatory markers for there. We have those guidelines, we have protocols, the Fetal Medicine Foundation softwares, in which we have to check with the NTNB is basically nasal bone, the nasal bone of the developing fetus, and the NT is the nuchal translucency, which is a fluid-filled space just behind the neck of the fetus. So those two things are mandatory. Of course, there are many other things which we have to keep scanning, like the developing skull, the developing brain, the developing overall embryo as such, both the limbs, the upper limbs, the lower limbs. So whatever we can document, we have to document. Again, according to the protocols, again to the guidelines, there is a documented guidelines. We have to follow those guidelines and keep doing it according to it. The other thing, important thing, which now the Fetal Medicine Foundation has added, and I think all the radiologists should now bring into their the limelight, is the pre-eclampsia risk assessment. Yes. So this whole month, the month of May, is the pre-eclampsia risk assessment. In my personal experience, I had severe preeclampsia in both my daughters. It was a ghastly experience. I remember being really sick, and thankfully I was a doctor, so my life was saved. But there's a high incidence of women dying with preeclampsia or having premature babies, growth retarded babies, kidney failures, liver failures, widespread problems because of preeclampsia. So now, thanks to the Fetal Medicine Foundation software, there is a risk assessment wherein we taken the Doppler parameters, that is the blood flow parameters of both the maternal uterine arteries. So there is a right uterine artery and a left uterine artery. So we measure the blood flow, and then we measure all the parameters of the lady, the pregnant lady. That is the BMI, previous any miscarriages or any problems in the pregnancies, their blood pressure. If one time the blood pressure is coming high, then let the patient relax, take the blood pressure again, height, weight, diabetes, all of those we have to put them under software. And then the software calculates the risk assessment. And if the risk assessment is high, we encourage the gynecologist to start with low dose ecosprin at night. And believe me, I have seen miraculous outcomes giving the low dose aspirin.
So again, correlation and coordination with
yes,
clinician and radiologist is really important.
Absolutely. In pregnancy, it has to be absolute correlation. Right. Therein we cannot, none of us can work only on ego. That is so important. The patient's age is so important. And nowadays, with people planning their pregnancies after the ages of 32, I remember when I was young, it was a part and parcel of life that by the age of 30, you're supposed to have your 2 children and over and done with the story. Now patients start planning their children at 32, 35. The other day, I had a very young looking patient she was 39. She was not looking 39. She was looking like a kid. And it was only when we started doing her parameters, and then I rechecked her age, and I was okay. And in spite of everything being normal, just a minimal changes in the Doppler parameter, which at the age of 30, the software would not have calculated the risk assessment, but because she was 39, it came as a risk assessment, because even though she's looking very young, yet the chances of developing preeclampsia as her age goes up exponentially increases. So this is so important, and we as radiologists are definitely trying to generate this whole thing, because a lot of centers are not doing it, or even if they're putting it just like that, okay, now everybody's doing risk assessment, they are not actually measuring the parameters. So patient, now here comes in, the patient has to be knowledgeable about these, at least educated patients. I'm not talking about patients in the villages. At least educated patients should know about it.
Correct.
That, this is something which I have in my social media awareness program also. I've written that please find out that, and if they are putting in a risk assessment, and if they have not measured your BP, your height, your weight, then please ask them that you never
Absolutely.
measured it. How did you
If
find
all
out the
the
risk
new
assessment?
techniques are available and so much is of research is already going on,
Yeah.
why not use it?
Absolutely.
Right.
And even if on paper, you should read the report. Even on paper, if somebody has given you a risk assessment of being normal, please go back to the radiologist and ask them that, did you never measured my height or weight?
Correct.
So how are you putting in the risk assessment? Because even in 5 kgs weight increase, suddenly the risk assessment goes.
Correct.
So that is the new thing which has come in.
And in case of like twins or triplets, we have to follow the same things, right?
Yeah,
Or
totally.
Any special like advice from your end for mothers if they have like twins or triplets? Any additional tests they need to go through, or any?
Of course, with nowadays we do go in for, after doing our level 1 scans, dual marker has become mandatory. Dual markers become mandatory again if it's a low risk level 1 and it's a low risk dual marker, then of course you are pretty safe that the initial manifestations of these syndromes are not there in your baby. However, if any of these have come out to have any risk factor, the nasal bone is a little hypoplastic, the nuchal translucency is a little enlarged, or there's something going on, it's a 2-vessel cord, some other risk factor, then definitely please go ahead with a second opinion. Go ahead with genetic counseling, and again, go to a good fetal medicine expert, go to a good genetic counseling person who will suggest you and advise you when you should go in with just a pathological investigation like NIPT, when you should go in with amniocentesis. So again, there are all now with Fetal Medicine Foundation giving us all the protocols and the guidelines. We have to follow the guidelines.
Correct.
And you can actually, if the patient can go on Google themselves and check out all the guidelines.
Correct.
And also, like, again, I would put in a word of caution to the patients, because a lot of patients keep actually asking me also on DMs on my Instagram, my baby's having this, what can I do? Don't do that. It's best to go to a good center, find out. I may not be able to see you in totality. You have to, if there is a center, go in for a second opinion to a good place. In Delhi, Delhi, Noida, we have very good second opinion centers. There are such good fetal medicine experts, people who are doing all sorts of things. Please go to them, take their opinion, and then make your decision. Please just don't WhatsApp to any random doctor whom you've seen on Instagram, or you please go ahead asking your relatives. That's another problem in India. Everybody asks their relatives for every problem. So don't do that.
Whoever has like 2-3 kids, he must be the most experienced
Absolutely.
person. Let's go to.
Absolutely. So follow the protocol. The guidelines are coming in a big way in India. Follow them.
And even after so much of advancement, I have seen some of the cases like some congenital disease, maybe something related to heart valves not developed properly.
Absolutely.
Can these things be diagnosed well before the delivery?
With fetal echo now coming in, again, we have to understand that fetal echo has to be done at 24 weeks. So the level after the level 1, there's the second trimester anomaly scan.
A mandatory or recommended test, right?
It is still not in the guidelines for it to be mandatory, but to all my patients, I always tell them it's not mandatory, but in my point of view, please go. Even if in so the level 2 is the second trimester anomaly scan, which is about 19 to 21 weeks or so. In that, as a radiologist, even though I have looked at your heart and I feel it's all looking all right, please go ahead with a dedicated fetal echocardiography. And in my report, I do mention that dedicated fetal echocardiography is not a part of this report, because by 24 weeks, the heart is really well developed, wherein all the finer details of the heart can be looked up. And again, please go to a dedicated person who is doing dedicated fetal echocardiography. At least in big places like Delhi, NCR, Gurgaon, a lot of specializations have started. So please find out, ask your referring doctor, and go to a person who is doing a dedicated fetal echocardiography. Find out if they have the machine. Again, here comes the technical aspect. We have all sorts of ultrasound machines, but then there are some dedicated fetal echocardiography machines in which we can see the heart really in a zoom appearance, and a lot of finer details are available. So please go there and get yourself scanned. And
Okay.
yet sometimes very generally after going in through all of this, it becomes very rare that a anomaly is missed. However, sometimes anomalies with long bones, some small thing in the spine, even if we have really assessed the spine very well, sometimes in because again obesity is on the rise. So in patients who are a little obese, where the sonographic window is not good, where the technical factors are not good, sometimes yes, things can still be missed.
Mm.
So I am not saying that it's
Mhm.
completely 100% foolproof. And therein a word of caution to all my colleagues, all my
Mhm.
radiologists: please check what are the wordings you are putting, because in the medical these days, in medical legal in the age of medical legal litigations, please then put a word of caution in caps lock on top of your reports
Right.
that the sonographic window was poor, the BMI of the patient was high, or whatever other technical details or problems you'll. And again, don't let your ego come in the way. You can, even though you have done a whole level 1 or a level 2, if you feel there's something I couldn't see,
If there
please
is a
refer it.
slightest of doubt,
Refer it to a senior colleague,
yes,
refer it to a
absolutely.
better
Mhm.
center, to a higher center. That's best.
Right. And
So
before moving to the next topic, since this I feel is an interrelated topic, along with the diagnosis part, since you are also a nutrition consultant, so to like young mothers, what kind of advice you used to give basis on whatever you are looking at in their reports, be it ultrasound or anything?
yeah, actually, the most important thing is to understand what is processed food and what is junk food. For instance, a mango shake is a processed food. We in our ancient times, we are not we none of us, even in we were grandfathers times or ancestors times, we used to peel a mango and eat it. One mango, our stomach is full, and then we used to walk. Where are we walking? We are actually looking at our smart watches and thinking, oh my god, did we put in our 9,000? People are not even walking 5,000 steps.
Correct.
You're keeping, so you're actually keeping pets so that you can walk, and then the dog walker is more walking more than you are walking.
True.
So just yesterday I had a patient who I said, please eat clean and nutritious food. She said, yeah, I'm eating mango shake and banana shake. And she was a little obese patient with a high risk problems for developing diabetes, for developing hypertension. And I was like, stop it. You can't take those banana and mango shakes. Take a half a mango, which is, sufficient for you, or take papaya, take watermelon, or maybe, just avoid those kind of fruit and have a more of a protein based diet. Again, India is a country where protein is like, people will be so scared about eating protein, wherein they will go to the nearby shop and have 4 samosas with
Mhm.
2 cold drinks, and they will not feel guilty about it. And protein is like the buzzword. Oh
Correct.
my
There
god, the
is
whole
like extreme sides. Some people are
extremes.
really scared of eating proteins, or somebody is
Some
really,
people are living on
yes,
protein
yes, they
shakes,
are.
and there is no, you're absolutely right. Even on
Mhm.
social media, you will see these people who are just having so much protein, and then there are people having zero protein, and then there are vegans, and then there are vegetarians, and then there are all sorts of people. And I'm like, why can't we just follow a median line? Protein is important. If you're a vegetarian, take your paneer, take your doodh, take your milk, take your curd. If you're a non-vegetarian, at least take your eggs. Again, the whole concept of removing the yellow from the eggs. Now American Heart Association has totally done away with cholesterol being the enemy. There is a lot of data which shows that it's the cholesterol which is the, which has been actually hit by a carbohydrate kind of a content, which is the oxidized cholesterol.
Mhm.
That is which is what is the enemy. It is the triglycerides which are now the enemy. But yet people are throwing away the egg yellows. So
Mhm.
to all my patients, that's one awareness I try to maintain, is that please eat clean, eat green, eat homemade stuff. Any packaged food, you are spoiling your inner environment, and you're spoiling external environment.
Mhm.
We are littering the our
True.
external environment. And even those shiny packages, those aluminium and whatever lining they are putting, that's directly related to cancer.
Exactly.
I mean, I'm surprised where people are ordering those big bottles of water which are stored in those plastic cans. I would rather have some contaminated, not that good water from my tap than have water from those plastic bottles stored in it for ages. So we have to, somehow draw a mean line about what is excess of, doing funny things, and excess of following which kind of a paradigm are we trying to follow. In the end, eat clean, eat green, have your protein. Stay
Correct.
away from junk food, processed food.
As we are talking about protein, I like to know your personal opinion because you are also into fitness.
Yeah,
Any protein
absolutely.
supplements nowadays there are Indian and
A lot of
global
protein
brands are
supplements.
there.
Absolutely.
So while choosing any sort of protein
Yeah,
supplement,
yeah.
what a couple of things which we need to take care of. And secondly, have you seen in your personal practice any such cases wherein people are taking like
A
lots
lot of
of
protein
protein
supplements.
supplements and they are getting some sort of like
Yeah, yeah.
impact on their
Both
liver
things I
or
have seen. Both things I've
Mm,
seen. Both the situations I've seen.
uh,
Coming to protein supplements, the one thing which I always like to tell people is try to see which supplement is really clean, which has been suiting you over the period of time, which is of a good brand. So, and also usually I recommend to those people who are pure vegetarians
mhm.
or in elderly. For instance, my parents, their diet has become so they eat so less that if I tell them please have 3 eggs, they will literally eat nothing the whole day. So in elderly people above the ages of 60, please have your protein. Protein is the building blocks of our cell. And the moment we start going on a low protein diet, it creates havoc inside our body. Of course, any day I recommend having protein from food. That is, in vegetarians, please have your paneer, please have your Greek yogurt. At least you can just hang your curd in a muslin cloth and eat the thick curd, and you have your good quality milk. But in those who are pure vegetarians, how do we? There's just no
There are
way
very
where they
limited
can.
options we have.
If you're non-vegetarians, usually I tell them have your non-veg and have your
Mhm.
eggs. And once in a while, like sometimes if I'm having a really tough gym workout day, or I'm feeling that I will not be having, I'll be having a very busy day. I'll not be able to take my lunch. I do take in my protein shake. The problem with all these shakes which happen is that now we are having n number of companies, and mostly we don't know what they are putting into it. And whenever we are purchasing a protein shake, please look at the content of protein vis-a-vis the carbohydrates. Most of these protein bars, I mean, I did do a couple of episodes on them as well, because please read the fine print. You will have protein like 10 grams and carbohydrates like 25 grams, and then the patient says, I don't know why I had diabetes. I used to have protein bars. So, well, you are consuming 25 grams of, you have a mango. At least that will give you some antioxidants, and it will give you some fiber. Have a banana, it will give you potassium. But why are you having those protein bars? So, if you really want to have a protein bar, then maybe just have it as a sweet dish, just like that. So that is where I see, please read the labels. The more funny things you see on the label, the more chemical sounding names, avoid that. Even when purchasing non-vegetarians, you purchase processed food like salami, sausages. I literally have taught my children to read the label. I tell them that please, if 4 chemical things if you're reading the label and you can't pronounce those chemical names, please steer clear of buying those
Golden rule.
products. People feel we are having a lot of
Mm.
salamis and we are having sausages and all those things. Read the fillers they have put in.
Absolutely. Fillers and preservatives, they are the
Preservatives.
most dangerous.
Now, but the problem in India is that we, at least in outside countries, at least when you buy organic, you know it is organic, or it is grass fed, and it is
Yes.
pasture fed, and it is corn free chicken and all that. Now in India, we have to again walk
They
those
have
thin
like a
lines.
certified organic thing. In India, we have natural organic, and this is a really
We
gray area.
really don't know what
We really
what we,
don't.
so we have in India, we always have a struggle with
Correct.
how do we stay disease free, because we are living amidst adulteration, pollution in every single thing.
Mhm.
So sometimes it's a choice between devil and the deep sea. Would you have that chicken in which you don't know whether they've put the hormones, or will you have that protein shake in which they've added something? It's actually a choice between devil and the deep
Right,
sea.
right, right. And eating clean food, how do you see it can help in terms of any sort of disease reversal and making your body and organs
Food is
healthy?
medicine. Food is medicine.
Mhm.
We never saw yesterday we were having this discussion in the gym that all of us were trying to do the squats and sit in deep
Mhm.
squats, and we were like, look at the villagers. They used to sit for 1 hour in their panchayat and
Yes.
smoke their beedis
Uh-huh.
and sit in
And
deep
even
squats.
farmers, while they cutting their ready crops, they used to sit in that position for like long hours.
Even today,
Huh?
I was feeling so embarrassed at myself that I was like, I have gone to the gym in the morning and I've done this and I've done that. And then I was walking my dog and I saw this farmer who was squatting very comfortably in the heat, and he was nicely digging up stuff. And he was actually, maybe he might be healthier than I am, because he's absorbing the rays of the sun. He's grounding himself, he's touching the earth. hygiene is another issue, which is like all the parents are forcing their children to be so hygienic. Every time they touch something, spray. There's no free trying to touch the, doing stuff like just playing. Wash your hands 10
All these
times.
things, like so-called precautions, are leading to allergies
Oh,
because
too
because kids are
much.
not at all exposed to certain things.
So much. So much. Just dealing with the dirt, sitting in the sun, having pets in the house. These things are so important to get up your immunity. Staying clear of antibiotics, at least in the first couple of years. I'm always like, don't give your kid the antibiotics. Stay clear of antibiotics. Child is going to suffer, but the immunity will be built up. So these are problems of plenty, I guess.
I agree. And do you like to burst some of the myths? Now, again, going back to radiology part and like some of the food habits or any nutrition part, you can combine both of the things. Any myths with respect to diagnostic techniques, like people are really
Yeah,
scared about getting X-rays multiple times, maybe
yeah,
ultrasounds, or there are certain food habits in which we have debate or misconceptions. In case, basis on your personal
yeah,
experience,
yeah,
if
yeah.
you like to
So
bust anything.
regarding radiology, we should understand that, say, yes, CT has radiation hazards. So to all the clinicians and to all the people hearing me here today, I would say please definitely ask the doctor why they are recommending a radiation based investigation, which is CT scan, because nowadays I'm seeing you go to a doctor with the just a minor headache or a migraine, and a CT scan is advised. So please steer clear of radiation based modalities like CT scans or too much of X-rays, especially in young children. And also go to a center where they use a technique which is called ALARA, which is as low as reasonably achieved. So, and all the recent generation CT machines have that modality wherein you just have to click that here, and the voltage from the CT machine is reduced to the lowest possible in the pediatric cases. Please be very, very careful about the amount of radiation succumbing a pediatric age group patients to. Even in adults, please do not just keep recommending investigations. Patients are also very happy in getting investigations
Yeah.
done. So just steer safe of at least the radiation based investigations. MRI is of course magnetic resonance imaging, so at least it doesn't have radiation hazards. So if you're just feeling like getting a brain something done or a spine something done, then please get an MR rather than CT. Again, people over the ages of 40 or 50, when you get an MR done for your knees, for your spine, for your hips, something or the other will always come out. You will have discs, you will have degenerations, you will have problems in your knees, you will have early osteoarthritis, you will have some hip here, there, and everywhere. Rather than again depending on medicines, please understand that movement, strength training, yoga, gym, these are your medicine. Medicine long term, it doesn't work. Even if you are diagnosed with early osteoarthritis and ultimately the doctor says that, okay, knee transplant is now going to be your treatment of choice. Believe me, even after knee transplant, you will have to lose weight, you will have to eat clean, you will have to go to the gym and start building your muscles. Otherwise, the pain will just come back. So rather than using that as your last option of getting a some kind of a surgery done, use non medical or non operative methods like just building up your strength. That is painful, that is slow, but that is actually which will help you. That is one thing. The second thing, then coming back to ultrasounds, ultrasound is very safe. Ultrasound has literally no hazards like that. Yet, in very early pregnancies, in little tiny growing fetuses, we do avoid the usage of color Doppler. A lot of patients tell me, ma'am, please show us in color. So you have to tell the patients that when we use color Doppler, then a bit of heat is generated from the waves, which is detrimental to the developing embryo. So please use that very, very sparingly. Once the baby comes, by the time you go ahead with doing your 11 to 13 week scan, you can use your color Doppler also, but yet still don't use, continuously use color Doppler. Focus on the vessels, take the reading, end of
And
story.
there is some debate around like intravaginal scans that they are not safe. So in
Yeah.
what conditions they are really important, and if they are at all risky?
No, intravaginal, transvaginal scans are very, very safe. And again, the technique of the doctor is very important. For instance, I really do good transvaginal scans. My patients are very comfortable in their scanning and they really have a very comfortable experience. So that is important. And if it's a married or even it's a sexually active unmarried female having any problems, they are very safe. They're
And
absolute
during the time of
misconceptions.
pregnancy as well, there is no harm to the fetus.
Unless, no, not at all. Not
Okay.
at all. In fact, in early pregnancies, it is recommended to do a transvaginal scan. The only place where a transvaginal scan is said to be a little unsafe is when you have a
Low placenta.
low-lying placenta.
Okay.
That also your first diagnosis was by a transvaginal scan.
Yes.
But by the time you are reaching your 24 weeks or 30 weeks, or if your cervix is getting shortened or dilated and it's irritable, and then you put your transvaginal scan inside and the cervix gets even more irritated, then are the times when again we can take full precautions and perform a transvaginal scan. And otherwise, if you know the technique of doing a transperineal scan, where we just put the probe on the private part and you can actually see it really well. So you can just use a transperineal scan for using that. Otherwise, if you are a sexually active female, I always recommend, rather than doing that full bladder, because then to see the uterus and the ovaries and the adnexa, you really need an uncomfortably full bladder. Sometimes when in unmarried women I'm performing I have to see the pelvis through the full bladder, the patients are very uncomfortable. The tears come in their eyes because I have to slightly press and try to see the uterus, ovaries, and the bladder is so full. So it is the investigation of choice. I don't think there's anything to be afraid of that. Of course, all hygiene and absolutely foolproof hygiene has to be maintained.
Correct. And one point which I missed asking you in between, uh, anything which is related to infertility, can that also be diagnosed through ultrasound or any other radiology technique?
A lot of people have a lot of misconceptions about ultrasound, like they are harmful. They are not harmful. They have radiations. They have no radiations, except that a bit of the heat generated from a pulse or Dopplers. People think they are useful only in pregnancy. No, they are useful every single place. As I said, they are used as a stethoscope. Again, people think that all ultrasound centers and diagnostic centers and all the machines are the same. No, you have to go to a certified, creditable person diagnosis center which has a good machine and a good integrity. So check the credibility of the centers wherever you are going. Again, people think the degree doesn't matter. As I just elaborated, MD, DNB and DMRD, those are the 3 credible degrees for performing a scan. If the radiologist has not put their degrees or put their stamps or put their either a UP or a Delhi registration number, please go back and ask them, where is the stamp? Where is the degree? And this is consumer awareness. I've seen the best of the patients coming to me with a report where neither the name is mentioned or there's a stamp and nothing is written. And then they're like, oh my God, what happened? So don't do that. And of course, ultrasound or TVS causes miscarriages. Again, a very big conception that my TVS scan was performed and then I had bleeding and then the baby was lost. In a lot of hospitals, I've seen patients fighting over these things. No, our TVS scan never leads to miscarriages. Yes, if the patient is already going into a miscarriage, or the patient's heartbeat has already gone. So many times the patient comes, but the patient is not bleeding, but the heartbeat is gone. And ultimately the patient will start bleeding because the abortion has happened and the body will discard the aborted fetus. And the patient may start bleeding, in the night after a TVS. Then the patient will say that I was perfectly fine and I started bleeding. So miscarriages, a transvaginal scan never leads to bleeding or miscarriages. And then people think that again 3D ultrasounds or 4D ultrasounds are unsafe. Again, they are completely safe. They are only based on artificial intelligence and software. And you can go ahead with the 3D, 4D images for in your pregnancies or for any other things which have come in. And nowadays even elastography has come in for fatty livers, for breast malignancies. They are also very safe, and I think they are rapidly going to give really good results in patients.
Right, right.
So ultrasound is extremely useful in infertility. For the diagnosis, in the diagnosis, the common problems are PCO, polycystic ovary disease, polycystic ovary syndrome. They're all the spectrum of the same disease. So that is the ovary. Again, let's come from the ovaries to the uterus. So in ovaries, we can diagnose by ultrasound. We can diagnose early ovarian failure by ultrasounds. We can also check the number of eggs, that is the antral follicular count, that we can do by ultrasounds. That can be correlated with the AMH. So in a lot of patients, when I feel that the antral follicular count is not good, the ovaries are not looking good, maybe the patient at the age of 30 is going into a premature ovarian failure, which has become very common these days, then I do ask them to correlate and check with AMH. So then the whole protocol will be changed, whether with the gynecologist. If I do diagnose a patient as a premature ovarian failure, or if I diagnose a patient with PCO, then the whole protocol gets changed. Then coming to the uterus. Now with uterus, the first thing is endometriosis, hitting either the ovaries or the uterus. A very important cause of infertility, of pelvic pain, of pelvic discomfort, of period irregularity, of heavy bleeding, of irregular bleeding, you name it and you have it. And now again, with the junk food, the processed food, the lifestyle issues, it's just a hormonal disbalance. The estrogen content of the body rises, which leads to all of these problems like adenomasses, endometriosis. So again, by ultrasound, you can very well diagnose that here the patient is suffering from adenomasses, the patient is having chocolate cysts in the ovaries, those are endometriotic cysts, and maybe you'll have to take out the cyst, or you'll have to do something before you can advise the patient to go in with a pregnancy planning. Then the lining of the uterus, you can very well document it by ultrasound. Again, here in the role of 3D. Recently, we had a patient in which the uterus was bifurcated. So you can very well document on 3D that, okay, this uterus is bifurcated. And if the sac goes towards one of the cavities, the sac will not grow because there's no space for the sac to grow. So how much the bifurcation is, whether it's just a simple bifurcation, whether the whole cavity is bifurcated, which are congenital anomalies, those can be very, very well picked up by ultrasounds. So so we came to the uterus structure, we came to adenomasses, endometriosis, we came to the endometrial lining. How thick is the endometrial lining? Is it responding to the changes, cyclical changes of your menstrual phase? So whether is it really becoming thick? Is it becoming good? Is it having a good blood supply? Again, we can pick it up very well on color Doppler. There is actually a whole paradigm called the uterine. It's called the scoring, the uterus scoring, wherein you can score the various things done. The blood flow to the uterine arteries can be scored, and you can give marks or points to it, about 9 or 10 points. And so if the patient has something like a score less than 5, then the chances of even IVF getting the embryo getting implanted there and picking up is difficult. You have to really give a lot of supportive treatment.
It's really important. If we have so much of medical
Absolutely.
advances, why not to use it and take informed decision basis on the outcomes?
Absolutely. Ultrasound is of prime importance when it comes to women's wellness. Starting from breast to abdomen to transvaginal to infertility to pregnancy. For women's wellness, I think ultrasound is of utmost importance.
Absolutely. And before we wrap up, I have just a couple of more questions related to for the young medicos who are completing their MBBS and opting for the master's or a specialization, and if they have interest in radiology, what's your advice? What kind of mindset they should bring in, and what will be the future prospects and growth opportunities in this particular area?
I think radiology is a very, very evolving branch, as I just said, because it's completely technology related. It's like a combination of engineering and medical field. So yes, radiology is still going on the top. I would encourage people to really take in radiology, because I think personally, in my opinion, it's a good blend of personal life and career and taking care of your family.
There is
also
no such emergency all the time. Things are manageable.
Yes.
You can plan accordingly.
Absolutely. But also a word of caution that please don't just become the man behind the machine. which a lot of us are doing because we are not bothering to talk to
Human
the
touch,
patients.
human
The human touch
interaction
is,
has to be there.
yes. You and encourage the patient to read up. Tell the patient, okay, you please read up and come. Whether patient is reading up any other article, patient is reading Google, whatever. You have to make yourself smart enough to answer their questions.
That should
And
be
you
the
have to be
case.
open to the patients. And when you, if there's a certain time when you are unable to, really pinpoint, so many times I've told my patients, it looks suspicious. It might be ectopic pregnancy. However, today I will not be able to tell you foolproof. Please do this. However, take my number, get back to me. I will, if something happens, get back to me. So also be available to the patients. Somehow I feel we should be available to the patients. Sometimes patients do disturb us at odd hours, but if possible, we should, we have to break this barrier of the doctors not being available to the patients and stuff like that. We have to, it has to be a joint kind of a approach, because I would, when we are at the receiving end, whenever we are admitted in the hospital as a patient, then we actually understand. The first time when a Vigo is put in your vein, I used to be very, when I was a resident, I used to be very, not very empathetic and very callous towards patients who had those Vigos and their hands used to be bandaged. And then I used to put the probe on their hands and they used to, really actually wince, or they used to say it's paining. I used to feel, why is it paining? It's just a Vigo, So because I was a young resident, when my first pregnancy, when a Vigo was put in my veins, and when then I experienced the pain, I am so careful. The moment I see a patient with a Vigo or something, or a bandaged arm, and they already had something, blood taken out, I'm very careful. I know it pains very badly.
Right.
So you have to remember the pain and the suffering which a patient has. No patient in their good frame of mind would like to go into the hospital.
All
And
the
again,
patients are all the time, they are in pain, anxiety, or
yes, we
confusion.
have
If
to.
someone is there to counsel and show some empathy, definitely they will trust it.
Absolutely. Empathy is really missing in doctors of today. And even when I was in the medical college, I used to teach all my residents, please show empathy towards the patients,
Right.
whether it's a poor patient. And, it's not that the patient should come to me with a reference saying that I have the reference of this person, please see me properly. Make it, it is a part of your Hippocratic oath. You have to, at least in the best of your knowledge, not make any diagnostic error, or impart the best to the patient. That of course, unknowingly, I must have made mistakes many times, but at least not knowingly. We have to, money is very, very important, but believe me, you can actually make a good amount of money being very honest, being very ethical, and giving patient good quality work. If you are chasing money all the time, then after a while it really will get you nowhere.
Correct.
So,
And before we wrap up, Dr. Pallavi, any message you like to give to our audience in general?
yeah,
Please go
I
ahead.
think I did wrote them. So I think this is a message, overall message, which on this is not something to do with radiology as my subject, but as my being into fitness and into health, is the 3 practical lifestyle tips which are very, very practical. Is number 1, be boring. So just follow the same routine, same lifestyle, same kind of food. If you know eggs suit you, then please keep having eggs. Keep having the same routine as much as possible. Or, okay, once in a blue moon, make a deviation, but routinely be boring. Wake up at 5, whatever. If you have dogs, walk the dogs, go to the gym, come back from the gym, go to your work, and follow a very predictive lifestyle. That's actually very good for your health and for low cortisol levels. Be consistent. Again, consistency is the key. You must have seen suddenly people start coming to the gym and they leave it. They start following some healthy lifestyle, they leave it. They start drinking some detox juice, they leave it. Be consistent. Consistency is again very boring. There will be times in your life where you'll just not want to do it. You'll also feel like pulling up your bed sheets and going off to sleep. But if you have built up your body to be consistent, the body will and the mind will force you to again go back to your consistency. And again, be stingy. And when I come to be stingy, please don't spend your hard-earned money on Zomato, on Swiggy, on all of these things, wherein even a person like me, the moment I log into any of these things, and so many options are there in front of my eyes, ultimately I may end up buying something additional which I do not want to buy. So even here, please buy things only which are mandatory, and rest, please be stingy. Try to cook food at your home. Do not order from outside, and again, you will also understand so much of money we waste on. Our health goes for a toss and our money goes for a toss. So the 3 take-home messages: be boring, be consistent, be stingy.
That's great. That's great. Dr. Pallavi, thank you so much for this knowledge
My
enhancing
pleasure.
session, and thank you again for answering all the questions in so much of detail.
I hope in not great detail.
Absolutely. It was in detail.
Actually,
To
both
be
the
honest, we
topics
have
are
covered lots of topic,
both the
and
topics are so close to my heart, both radiology and health. In
yes,
fact,
yes.
both are so close to my heart.
Mhm.
If you ask me to choose between one of them, it's going to be very difficult for me to choose which
I
is
can
more
imagine. I
dear
can
to my
imagine.
heart.
And definitely, there are some more things. Maybe we can do some deep dive on certain more
Yeah,
topics,
yeah,
and we will
absolutely.
plan for a next round of discussion with you
Absolutely.
that will be more centric to some of the topics. And
Absolutely. Like infertility is a big topic in
yes,
itself.
yes, yes. We
There's
can have
so
like half an
much,
hour
yeah,
discussion on
yeah,
that
there's
topic.
so much in radiology only on
Mhm,
infertility.
mhm.
It's a big, big topic. And years back, I was working on a very big IVF center in Lucknow. And believe me, infertility was such a unheard of phenomena.
Mhm.
Although it was very few people who used to work. These days, 30-year-olds are going in for infertility treatment. 30-year-olds are having egg counts almost zero, premature ovarian failure, endometriosis, PCO. Like their health is gone for a toss.
So next time when we will meet, we will
Absolutely,
cover
because
the holistic side of all these like health
also
issues,
I think
and
which something
through
I feel very
nutrition, diet, and
strongly.
wellness, how we can
One thing
cope
which
with.
I feel very strongly is that the how women are it's become a sort of a norm. It started from my generation
Mhm.
when women are suddenly told to push themselves, work so much, break the barriers, break I don't know which glass ceiling,
Mhm.
and in the end, it's their health which really suffers. 'Cause we have to understand estrogen, progesterone, oxytocin. It
Yes.
works very differently.
Metabolism and the side of
I
hormones.
mean, I have been so anti-feminist when
Mhm.
even though I'm a strong feminist myself, but I've been so anti-feminist in telling so many of my early pregnancy women, just leave your job, sit
Mhm.
at home, do nothing,
Take some rest. Take
take some
good care of
rest,
yourself.
don't go, don't
Yeah.
work.
Yeah.
I can write a low-lying placenta if
Mm.
you want. Don't work, don't go. I mean, so many times, and
Mm.
really, they have benefited so much. Women coming to me with growth retardation, some fancy job and something, and I just tell them, take some leave. Now women laws have become so strict. The moment they take even a 6 weeks leave,
Mhm.
the
Mhm.
baby starts growing by leaps and bounds.
Correct.
So that is something which I think this whole feminist
Mhm.
trait, instead of tackling actually the genuine concerns and the genuine problems of women as to how we can support a mother, a young child, or a young female, a young mother, a menopause. Menopause is another such an important topic. I can
Yes.
keep
Yes.
speaking about it.
Correct. Correct.
So rather than that, we have actually told women that smoking, late night partying, drinking, I don't know, super excelling at your jobs, breaking some ceilings. That is what is actually we are
I
supposed to
also
do.
think the two most important thing during the pregnancy is having peace of mind,
Yeah,
good rest, and have good diet.
absolutely.
Not need to change any other thing.
Absolutely. वो पुराने समय में नानी
हाँ,
दादी कहते
हाँ,
नहीं थे
हाँ,
कि इतने दिनों तक बाहर नहीं
हाँ,
निकलना
हाँ,
है.
हाँ,
Well, that's why they used to say, because
हाँ,
rest is so important.
exactly,
Sleep is so
exactly.
important. If given a choice between early morning, ये और आजकल शुरू हो गया है कि 3 घंटे सो के सुबह 4 बजे आप उठो और जिम जाओ. Those Instagram people are full of people running at 4 a.m. in the morning. I've also done that. And then I really suffered in between. I suffered also because of, doing extra healthy things.
Mhm.
Waking up at weird hours and running, cycling for 200 kilometers. And then I realized that, okay, this is also as harmful as not being healthy. There's something as being too healthy also. So
Mhm.
all these myths of which have been thrust in our brains thanks to our social media. We suddenly wake up in the morning and suddenly we saw some ad or something, somebody who's running at 3 a.m. in the morning in the dark, and when we are like, okay, we should also do this. And recently, who had this heart attack? Who then said, I think the CEO of Zerodha, who had about a couple
Yes, yes.
years
Co-founder
back.
of Zerodha,
Huh.
Nitin
Yeah,
Kamath.
yeah. He said that I think the main
Mm.
cause was here I wasn't sleeping.
Mm.
So sleep is so important. I always tell all my clients who then ask me, okay, ma'am, then we will wake up at 4:30 and then 5 a.m. we will go to the gym. And I say, no, then don't go. Just walk, please sleep. I would rather you don't go to the gym. If your job doesn't allow you to go to the gym, I would rather don't go to the gym. Please just walk, do small things like walk in your
Correct,
office,
correct.
take the stairs. Don't wake up at 4:30 a.m. in the morning and hit the gym at 5 o'clock. That's
Correct,
again,
correct.
sleep is so important.
Agree.
So,
And definitely we will meet up soon and
absolutely.
cover some of other
That'd be my
topics
pleasure.
in detail. But
Mhm.
till then, thank you so much for your time. Thank you
My
so much.
pleasure.